Hey, what's up? I hope you're ready to learn something new today. In this video, you'll be able to learn and understand the drug omeprazole. So, get yourself ready and don't forget to have fun. Hi, I'm Omeprazole. This name is my generic name, but you may already know me by my brand names, which are Prilosec and Prilosec OTC. I also have a chemical name, which is 6-methoxy, 2,4-methoxy, 3,5-dimethylpyridine, 2-L-methane-sulfonyl, 1H13-benzodiazole. My drug classifications are anti-ulcer agents and proton pump inhibitors. I am also classified as a Category B drug. This means that animal reproduction studies of me have shown an adverse effect on the fetus, and there are no adequate and well-controlled studies in humans. But my potential benefits may warrant my use in pregnant women despite potential risks. So, what is my mechanism of action? Once I am inside your body, I bind to an enzyme on the gastric parietal cells in the presence of acidic gastric pH, thereby preventing the final transport of hydrogen ions in the gastric lumen. Here is my pharmacokinetics. I am rapidly absorbed following oral administration. I am well distributed into the gastric parietal cells. In addition, I am extensively metabolized by the liver. My onset is within an hour after administration, and I reach my peak level within 2 hours of the administration. Also, my drug duration is 72 to 96 hours. My half-life of elimination is about 0.5 to an hour after administration, and I am excreted as metabolites in the urine. The remainder is found in the feces, primarily originating from bile secretions. However, when patients have liver disease, my half-life increased to 3 hours. I am indicated for patients with gastroesophageal reflux disease or the maintenance of healing duodenal ulcers. I am also indicated for short-term treatment of active benign gastric ulcer and for the reduction of risk of GI bleeding in critically ill patients. I am contraindicated to patients with hypersensitivity, liver disease, and to infants. I must also be used cautiously to pregnant and lactating women. Like any other drugs, I also have adverse and side effects. For the central nervous system, I have 4 adverse and side effects, which are dizziness, drowsiness, fatigue, and headache. My adverse or side effect in the cardiovascular system is chest pain. I also have dermatologic adverse or side effects, which are skin rashes and itchiness. Lastly, my adverse and side effects in the gastrointestinal system are abdominal pain, acid regurgitation, constipation, diarrhea, nausea, and vomiting. Before my administration to a patient, the nursing responsibilities are assess patient for allergy to the components of omeprazole, assess patient for any contraindications to the drug, instruct patient to take medications as directed for the full course of therapy, even if the patient is feeling better. Also to take missed doses as soon as remembered, unless it's almost time for the next dose. And do not double dose. Advise patient to avoid alcohol, products containing aspirin or NSAIDs, and food that may increase GI irritation. During administration to a patient, the nursing responsibilities are Monitor CDC with differential periodically. Monitor INR and prothrombin time in patients taking warfarin. Administer doses before meals, preferably in the morning. Capsules should be swallowed whole. Do not chew or crush. Capsules may be opened and sprinkled on cool applesauce. Entire mixture should be ingested immediately followed by a drink of water. When using powder for oral suspension, administer on empty stomach at least 1 hour before a meal. For patients with nasogastric or enteral feeding, suspend feeding for 3 hours before and 1 hour after administration. Empty packet contents into a small cup containing 1 to 2 tablespoons of water. Do not use other liquids or food. If administered through nasogastric tube, suspend in 20 ml of water, stir well, and drink immediately. Lastly, I may be administered concurrently with antacids. After administration, the nurse should assess for epigastric or abdominal pain and frank or occult blood in the stool, emesis, or gastric aspirate. That's all you need to know about me. Thank you for watching.